Welcome back, Supermoms. Most of us are concerned about when to start the first food for the baby, what to give and what not to give. So today I am going to discuss about that. Suggestions pour in from the well-meaning relatives, and at times it can get very confusing. So why don't we discuss this topic on when to start the foods, what to give, what not to give, and the general rules of complementary feeding. When to start the solid food for a baby? Well, according to the Indian Academy of Pediatrics and American Academy of Pediatrics guidelines, a baby who is breastfed has to be exclusively breastfed for the first 6 months of life. That means they should receive only and only breast milk and nothing apart from the breast milk. That means no sips of hot water, no sips of sugar water when the baby has colic, no native medication, no honey, nothing. Nothing apart from the doctor prescribed multivitamins like vitamin D and A to Z vitamins. In non-breastfed babies, if they are not gaining weight satisfactorily after 4 completed months of their life, we can consider starting the solid foods with single grain cereals which are easily digestible and some fruits. Well, what's the harm in introducing food a tad bit earlier? There is a lot of harm. We inadvertently expose the baby to the risk of food allergies and digestive problems. Not only that, breathing problems like wheezing or skin allergies for the rest of their life if we are giving the baby substances or foods that are hard to digest even before the digestive system matures. So please do stick and adhere to the guidelines. So what are the rules of complementary feeding? Always feed the baby with solids when the baby is in a propped up position. Never feed a baby while placing the baby with a head low position. That means never place a baby on your legs and start pouring in the food into the mouth of the baby. The baby should always be propped up position. That means the head has to be upright or almost in a sitting posture. This is precisely why 6th month is a good time, because the babies already have developed the sitting with support developmental milestone. And then always give a new food only during the daytime, because if the food doesn't suit or if the baby develops an allergy, we may not be able to appreciate the rash in the darkness of the night, or we may not rush to a hospital in time. So always introduce a new food only during the daytime. Then once we introduce a new food, the same food has to be given on 3 consecutive days. Why? Because the baby is still trying to explore the taste buds, the consistency of the food. Not every food is the same. So some foods are very sticky, some foods are too watery and runny in consistency. So the baby is exploring the consistency, and day 1 the baby may be little resistant to accepting the food. But the same food when the baby receives on day 3, the resistance could go a tad bit low and the baby may be accepting the food readily and happily. And then no salt till the baby is 2-year-old. Why? Oh, without salt the food is absolutely tasteless. Yes, I agree, but breast milk does not have much of salt. The sodium content of breast milk is very less, and breast milk indeed has some amount of lactose, which is the sweet. So babies do understand the taste of sweet much better than that of salt. However, I suggest you to introduce the bland taste like that of a steamed or baked potato without salt or sugar or anything. Once the baby accepts this kind of food, it would be easier to introduce the rest of the fruits and vegetables. Moreover, salt is something which is responsible for increasing the blood pressure, and the immature kidneys of the babies are not doing a great enough job to push off all this unwanted and excess salt from the bodies. So it can do a lot of harm to the baby. So no salt, no sugar, and if sometimes something like a pumpkin squash which needs to be sweetened, maybe you can consider adding dates, that too only after 9th month, or jaggery. Palm jaggery is a very good and rich source of iron. So please consider adding jaggery instead of sugar. Then, how much to give? Why don't we allow the baby to decide how much she wants to take? Let us pay a bit more attention to the satiety cues of the baby. Well, having said that, I would say initially when we are starting out the complementary feeding, we are not trying to give her an entire meal. We are only checking if the taste and the consistency are okay with the baby, and if the baby is able to coordinate the swallowing and the breathing at the same time without choking. So initially day 1 it has to be hardly 2 to 3 spoonfuls, and gradually we have to build it to the level of a small cup. And if the baby wants to eat more, by all means the baby is welcome. And then how to make the first porridge of the baby? Well, I would say take any rice of your choice, red rice, brown rice, or the normal polished rice, or the basmati rice. But I would say basmati rice is very much polished and it would probably not have a lot of vitamin B complex. So probably I would stick with the white rice. So take any rice of your choice, wash it and dry it, and then powder it very nicely in the mixer. Then store it in a jar. Take 1 spoonful of this particular powder, add it to boiling water, mix it until it becomes a gruel. Now initially the water has to be more so that the consistency of this gruel is runny. Gradually we may decrease the content of water and make it semi-solid to solid. And then the consistency of the rice grains also, initially what was fine powdery, we can gradually make it more and more coarse until by 1 year the child should be able to eat the food all by her own without the mixer. In the subsequent months we may introduce dal. Take 3 cups, 1 cup of rice, 1 cup of dal, either moong dal or chana dal, and then 1 cup of ragi, and wash them, dry them, powder them, and then use it as a gruel just as was discussed before. Please do not add any salt, especially please refrain from adding pepper. Some elders do believe that pepper increases the digestion, but what do they mean by increasing the digestion? They increase the acid secretion in the baby. This can be very bad because babies can have regurgitation, they can have cough, they can have vomitings, and they may not be, they can be very gassy. So please kindly avoid using pepper. Cumin or arginine is fine when they are used in very lesser quantities. Slowly add green leafy vegetables and the normal vegetables to this particular gruel to make it more energy dense and vitamin rich. In the 7th month, we may consider using all the peas, peaches, plums, pears, carrots, peas, beets, bottle gourd, ridge gourd. All the easily digestible fruits and vegetables can be given in the 7th month. Again in the 8th month, greens should definitely be given because they have a lot of fiber. And then egg yolk should be introduced first, and egg white has to be introduced a tad bit later. This sequence is mostly for some reason reversed in India. They consider egg yellow is very difficult and hard to digest, but egg white, the egg albumin, has the egg protein which can give reactions. So I would say please wait until you finish the typhoid vaccination, until the baby completes 9 months, and then in the 10th month please introduce egg white. And then coming to the 9th month, we can introduce the thin chicken soups, right? And then we can introduce all the fruits and vegetables that were considered allergic earlier with a bit of caution now, like tomatoes, kiwi, berries, beans, broccoli, cauliflower, and corn. In the 10th month, we can increase the consistency of the chicken gruel and we can introduce freshwater fishes. Why? Because sometimes in seawater fishes there can be a lot of iodine, and a lot of contamination with things like mercury, which can affect the brain growth and the intelligence development, pretty much everything. So having said that, fish is a very good and rich source of DHA, which is a component which is required for the brain growth. So I would say a hell lot of freshwater fishes, yes, a little caution and a little less of seawater fishes, and please avoid giving things like salmon fish, tuna fish. These are the things which are connected more with the allergies. In the 11th month, we would in the 10th to 11th month, we can introduce the millets and nuts. How to introduce nuts? The easiest nut would be cashew nut, starting with the cashew nut, badam, pista, walnut, and finally the groundnut. One after the other, we have to introduce powdered nuts. Never give a nut, even if the child is enthusiastic about doing the finger foods, please never give them the nut as such. If the nut gets struck, as a matter of fact, anything which is small and oval, like a groundnut, like pea, like beans, grapes, pomegranate, all of this can perfectly fit into the windpipe, the thinnest portion of the windpipe, and they can lead to instant death due to choking. If it is something larger or something of different shape, it can be easily picked out even at an ER. So please be cautious while giving a food which is small and round. And then nuts are a rich source of zinc, as I always say, and they actually help in the disease fighting capacity. So please don't back out on giving nuts. Please give a lot of cheese, paneer and tofu. These are the foods the vegetarians meat, I would say. There are hell lot of proteins in it, and they would help in the building of the muscles of the baby. So please definitely consider giving paneer. And then you can introduce citrus fruits a tad bit later, like in the 10th and 11th month. Sweet lime juice are favorite, right? So please introduce it a tad bit later because it carries the risk of allergies. Then by the time the baby is 12 months old, that is, by the time the baby turns 1, the baby should have tasted pretty much everything that the parents have done. So all the seafoods, all the mutton, and whatever you want to introduce, you can do it at this time. Before we call it a day, let us do some rapid fire myth busting. So breastfed babies need sips of hot water during summer. Myth. Not required. A mother has to take 5 to 6 liters of water per day, but the baby do not need absolutely anything. Giving sips of hot water carries the risk of infection. The baby can land in diarrhea and lose more water from the body. So absolutely no water. Giving honey or sugar water is good in colic. No, there is no proven medical benefit from giving sugar water. Please do not give. Unwanted sugars can lead to obesity in the baby, and there can be feeding difficulties. Baby would expect everything to be sweet. Baby would reject everything which is bland. So if you are planning to give healthy diet to your baby, please refrain from giving sweet water to the baby. Then gripe water. Gripe water is really good. The babies are chubby and all. No, it's a myth. Gripe water has alcohol. Earlier it used to have. Nowadays the gripe water label says it's free from alcohol. However, it still has preservatives like sodium parabens, which can affect the developing nervous system of the baby, and the baby can land into hyperactivity subsequently as the baby grows up. So please no to gripe water. Cow's milk should not be given to the baby until the baby turns 1 year old. This is absolutely true. There is an entity called cow's milk protein intolerance, wherein the baby can be very much bloated, gassy, can have vomitings and diarrhea and rashes, especially around the bum. This is probably because of cow's milk protein intolerance, and please try to avoid giving cow's milk till the baby turns 1. Continue either to breastfeed, or if that is not possible, please ask your pediatrician to prescribe a formula till the baby turns 1. Some people do believe that roots and tubers cause nitrate poisoning. Well, this is also a myth. There is no proven study scientifically saying that the carrots and the beets or tubers cause nitrate poisoning. When we get our groundwater as well from the ground and we don't get poisoned by it. Well, I would say too much of anything is not good. We have given the baby pretty much carrot in every single feed. That can lead to hyperkeratinemia, an entity wherein the skin and the nails of the baby can turn orange and the baby can present with something called pseudotumor cerebri, a condition wherein there is no tumor in the brain but it still mimics as though there is a tumor in the brain. So please avoid doing anything overboard. And then mangoes heat the body and people develop boils by eating too much of mangoes. This is again a myth. In pre-microscopic era, elders used to believe that the boils are caused by the mangoes or the excessive sugar. See, excessive sugar will obviously lead to a growth of bacteria, especially in the elderly people and the diabetic people. But coming to children, this is not very much associated. Mango is definitely having a very good content of vitamin A and fiber, and I would encourage babies to have a lot of mango. And coming to the boils are caused due to the blockade of the sweat and the sebaceous glands that are present in the skin. We do have a habit of putting a lot of prickly heat powder in the summer, and that powder goes and blocks the sweat pores, and there is a lot of growth of these microbial organisms like bacteria in the skin, and they cause the boils. So these two are not linked to each other. It is not safe to give dalia or wheat or biscuits before 7 months. Well, I say this is absolutely true. These products have gluten and they can lead to something called gluten sensitive enteropathy in the baby, which is a kind of difficulty with certain products of the food for the rest of the life, and they cannot digest these kind of foods. So please do not introduce dalia or wheat before 7th month. Eating bananas or curd can make you cough or sneeze. Again a myth. Curd taken from the fridge because of its cold temperature may probably make you sneeze, but curd which is taken at room temperature with hot rice will not cool the body, will not cause running nose or anything. It is again due to microbes and not due to the food. That is it for today. Stay tuned.